I'm Sam Dasari. I am a recent alumni of CBID. I currently work as an R&D engineer at Becton Dickinson, and I'm in a rotational program. So I'm able to work in different areas of R&D while being an early stage innovation engineer or being more of a sustaining engineer or somewhere in the middle. And it is a device that will non-invasively monitor early signs of pediatric congestive heart failure in populations who already have a heart abnormality, especially patients who have not had ways to monitor their symptoms at home. Me, as well as another teammate, are working on it part-time, and we also have it being incubated with some clinical advisors that we have at Hopkins. We left the year with a robust prototype, as well as an IRB approved to complete a clinical study. So this innovation really will transform at-home care for these patients. I knew I was really interested in medical device design, but I knew I was missing some key skills that I would need to really be a well-rounded engineer, as well as a leader and entrepreneur. CBID really offered that perspective into the clinical setting that I was missing while I was in undergrad, as well as the business aspect that you also need to understand when you build anything or innovate on anything. Building that case is really important. And I'm realizing that now while I'm working in industry. I came in with a pretty good understanding of how to be an engineer on a technical sense, but I wanted to get an understanding of the entire life cycle of design. So through CBID, I was able to really polish my ethnography skills, my voice of customer, and just really understanding where the need actually is. That skill is very soft, and you just have to understand that by doing a lot of clinical interviews and rotations. We were in the field of pediatric cardiology, so that is already in itself a niche field. Because we wanted to look at both the care pathway in the beginning as well as after an operation has happened, we were able to reach out and get resources to speak to attendings in the PCICU, which is the intensive care unit, and that's actually where we found our need. We also looked at post-operative scenarios such as rehabilitation, and so this was something that was really important to us to get a better understanding of the whole care pathway and not restrict ourselves to just one setting. We had collaborators in Children's National. We worked with main large hospital systems such as Boston Children's, as well as Children's Healthcare of Atlanta. So these are just some of where our clinical mentors came from when we created our committee for our company. But MiraHeart really showed us just how expansive pediatric innovation really is. We applied to lots of business plan competitions, participated and competed at Heartland Challenge, as well as the Rice Business Plan competition. Both places we did get funding, which was a really great experience for us, and we were able to pitch to a larger audience and get great feedback on how to sell our case and how to sell our need. And the most fun I've had was brainstorming with my team, just sitting there, a group of engineers, just figuring out how can we solve this issue, all these modalities of technology, all these modalities of the clinical care pathway, like how could we come up with something that works without having to reinvent the wheel as well. Being able to collaborate with so many passionate pediatric innovators, seeing that there is a market out there for people who really do need it the most but don't have that much innovation, which is surprisingly children, was one of the highlights of our experience. That made me realize I love early stage innovation. In my current role, I am still doing stretch projects in early stage innovation and a lot of BD's different projects they're working on. And my skill set does really shine because not many people have that path from clinical immersion to prototyping to creating a case for it. I think CBID really pushes you, and in the best way, like exposes you to a lot of new aspects of this industry or this field that you didn't know existed before. But being able to adapt to everything and just work really hard to understand it and adapt to your team, that is someone that will really excel.